Oh, there we go.
Awesome. Cool. Hello, everyone. Thanks for joining us tonight. Welcome to our next Wolfpack chat. We're going to just let people trickle in, and then we'll get things started. But before we do, my name is Austin Brown. I'm the ASUN President this year. I'm heading my senior year studying political science and psychology in the Honors College. Today I have Matt with me.
Hi, how's it going, everybody? My name is Matthew Hahn. I'm the president of the Graduate Student Association. I'm studying physiology and pharmacology for my PhD, and also working on my MBA in between, sleeping and school.
So before we get things started today, I just really want to plug that tonight we have our T-Pain concert. That's going to be doors open at 7 o'clock tonight. It's going to be at Lawler Event Center right here on campus. You can purchase your tickets at the door, $20 at the door of Lawler Event Center. So please come. We'd love to see you there. We're super excited to have everybody back.
Yeah, I think it should be a good kickoff concert for the entire semester. I'm pretty excited myself.
It's going to be fun. All right, well, and before we get started also, I just want to mention that for anyone who needs it, we do have live captioning available. You can go to the Nevada ASUN Instagram and click the link in the bio, and that should take you to live captioning.
Additionally, we're going to be doing some free vaccines over in the Fishbowl today, so if you guys have some time and you were looking at getting vaccinated, that would be the place to go. I think for the concert you get priority seating, right?
You do. Yep. Yeah. If you come up to the third floor of the Georgia College Student Union, you can show your vaccine card or a negative COVID test result, and you'll get priority seating and entrance into the concert tonight. So definitely take advantage of that.
Perfect. Well, it sounds like it'll be a fun time. Plus, I think everyone will be safe and it'll be a good time.
Exactly.
So
it's going to be good.
Well,
yeah. Okay. So today we're going to be talking with Dr. Cheryl Hug-English, the director of the Student Health Center here on campus, and really answering some of your questions about the vaccine, what that looks like on our campus. I know there's been a lot of updates today with the Nevada State Board of Health meeting. So we're excited to hear all of the questions that you have, and we're excited to hear from Dr. Cheryl Hug-English about what she has to say. So
I'm not sure if she's joined yet. Do you see her over there? Let's see. So we might have to wait a couple seconds to wait for Dr. Cheryl Hug-English to join, but she is the director of the Student Health Center, so she'll be here to answer all of our questions that are more COVID related, which kind of goes from things like the vaccine to actually COVID and how that will affect student life here. So.
Yesterday we had an Instagram Live with Provost Shantani, or Vice Provost Shantani, and we had a really great conversation about what our classroom experience is going to look like. So I highly recommend going and check that out. You can view it on the ASUN Instagram. We posted it yesterday in the grid, so feel free to go check that out and see those questions too.
Yeah, and if you guys have any questions today, feel free to toss them in the chat, and we'll try to get to them as we go throughout part of this program. So,
all right, I think we have English here, so we're going to give her a second to join, and then we will get started. Awesome.
You're also fine.
Hi, Dr. Hug-English. How are you?
Hello. Sorry about the technical difficulties. I'm going to take off my mask because I'm in my office alone. But I'm really happy to be with you. I'm honored to be with you. I have to say that I'm proud that my grandparents, my parents, myself, my husband, and my 3 children have all graduated from this wonderful university. And I have made most of my career right here because I love this institution. So I just want to say a big Wolfpack welcome. Welcome to the Wolfpack family, to all of you students. And I'm honored to be here today.
Thank you so much for joining us. We're super excited to hear all of the important information that you have for us regarding the COVID vaccine and how our campus experience is going to look like this year. So thank you for your service for our institution. We're really lucky to have you.
Yeah, I know a lot of the graduate students use a lot of the facilities over there at the Student Health Center, and I think it's a great partnership between students and healthcare.
Well, we are here because of you, our students, and we're thrilled to see you back in person this semester.
So I think we're just going to jump right into some questions, if that's okay with you, Dr. Hug-English. And so just regarding the vaccine in general, let's start at the basics of how does this vaccine work?
It's a really important question, and I think a confusing one, because the technology for some of these vaccines is new. We're very fortunate that we have not one, but 3 very safe and effective vaccines in the United States right now. 2 of those vaccines, Moderna and Pfizer, are what's called mRNA vaccines. And that is a different technology. mRNA stands for messenger RNA. And really the easiest way to think about it is messenger RNA is really a blueprint for the cell to produce a protein. And that protein is called the spike protein that then is the same protein that's on the surface of the coronavirus. So when that mRNA enters the cell, it then codes for a protein that is then released from the cell and attached to that cell surface and is recognized by the body as something different, something foreign. So our body creates an immune response and produces antibodies to that. And so that's how those vaccines work. One of the things that I will say in questions that have come up is concern about it altering our DNA. It cannot get into the nucleus of the cell. It simply goes into the cytoplasm of the cell. It cannot in any way affect our genetic material. So I think that's an important fact. The other vaccine, Johnson & Johnson, is a little bit more traditional, and it provides immunity by attaching to a viral vector. So it's an inactivated virus, a harmless virus, and it enters that way into the cell. It kind of is like a hitchhiker, enters in, and again codes for that spike protein, and which then attaches to the cell. So both technologies are effective, but just different.
That's awesome. That's really interesting to know. I had no idea. So, no, that's really cool. One of the other things about this vaccine that I think is kind of the question that we keep getting asked is, it's classified as emergency use right now. Is that correct?
That is correct.
Awesome. So what is that?
Go ahead, Austin.
Oh yeah. So what does it mean that it's an emergency use vaccine?
Yeah, so we hear that term a lot, and we hear that sort of means that maybe it isn't safe. That is absolutely not the case. Emergency use simply means that it hasn't been that long. So I will say for these vaccines, there was just an incredible amount of resources and effort put towards development of these vaccines that normally would have taken years. But because we were in the midst of a pandemic that none of us have ever seen before, a global pandemic, there was urgency to get these vaccines developed. And so money and resources that wouldn't have ordinarily been put forward were designated to the development. Not only that, there were many people that volunteered to be in the clinical trials that again would have normally taken a much longer period of time. So just because these vaccines are labeled emergency use does not in any way mean that they are less safe. The safety profile for all three of these vaccines have been vetted very thoroughly. And it will, we're hearing that likely will be soon that they will be fully approved, because what full approval means is that you now have longer term data as far as continued effectiveness, not continued safety. We know these vaccines are safe.
That's awesome. Gotcha. Okay. Yeah, I was going to say that's good to know. I think a lot of people were really concerned about, what's the safety risk for this whole vaccine versus, actually getting COVID. So it sounds like this is a very safe vaccine, coming forward. I guess kind of building off of that, so why is it important to get vaccinated if, you're a student here or if you have family at home, trying to convince them to go out and actually get the vaccine?
It's another really good question. And I think that what we know is that vaccination is the most important tool we have to combat the spread of COVID-19. We have seen over 625,000 people in our country die from COVID-19. And we are now in the midst of another surge, which with the most recent variant, the Delta variant, that we know is more infectious and is creating a significant spread across our country and in our state. So, vaccination is really the way out of this pandemic. The more opportunity we give this virus to sort of hang out, if you will, it gives it more opportunity to spread, and it also gives more opportunity for it to mutate, which is what we've seen with this latest Delta variant. And as that can happen, as we've seen, some of those variants can be even more infectious and cause even more problems.
Oh, gotcha. Okay, so I guess in terms of, there's been like a lot of students that, they've gone outside and they've actually already gotten COVID. So is it still important for them to get vaccinated, even if they've already gotten COVID-19 and quarantined and tested positive, everything like that?
So the studies are showing that the vaccine still boosts immunity even further than for people that have had an active infection of COVID-19. We don't know how long immunity lasts from this virus, from natural disease, if you've had COVID, but studies are showing that antibodies that we can measure easily tend to wane over 6 months or so. And so I think that the vaccination, again, gives that immune system another boost, if you will. It gives that production of antibodies sort of supercharged. And so I think it is important for people that have had COVID to still consider getting the vaccine.
Gotcha. So it kind of acts like a booster shot, kind of like the second shot for Pfizer or for Moderna.
It's similar to that. Yes, it gives the body an increased production of antibodies, and again more protection from subsequent exposure to the virus.
Gotcha. All right, thank you.
I feel like we're learning a lot about this vaccine. So I want to know, can we get the vaccine on our campus, or do we have to go off campus in the community?
Fortunately, you can get the vaccine on our campus. The Student Health Center does vaccinations every day, and Monday through Friday, I should qualify that. But you simply need to call ahead and let our staff know that you want to come in for a vaccine, and you can come in that day. We open a vaccine vial every day, and it's easy to get. It takes just a couple of minutes, and it's very accessible here. The other thing, and we're actually having a pod as we speak, right down at the Joe from 1 to 4 today. So anybody that's listening who decides they want to go get vaccinated this afternoon, that is available. We will also have some subsequent pop-up pods at different locations, hopefully in the coming weeks. We're looking at areas like near the residence halls and other places on campus. We want to make it as easy for you as students to get the vaccine as possible.
We really appreciate that. It's awesome you can just walk right up to the health center and get it. What are the hours of the health center during the semester?
So we're open from 8 to 5 and we work through lunch. So it's all day.
Okay, awesome. So then do you have to try to make an appointment if you want to get the vaccine, or can you typically just walk in and say, hey, I'm here to get the vaccine. Do I need to stand in line, or how does that process work?
So it's a good question. And in general, I will say that we ask everybody to call ahead right now for, any reason that they're coming to the Student Health Center, just so we have a little bit more control over density in our waiting room and accessibility, that people aren't waiting a long time. So it just means calling ahead, but you can get it that same day, and we'll just tell you what time to come in, so it's more convenient for you. You're not waiting. We can get you in and out. And again, a reminder that anybody that gets vaccinated right now is eligible to submit online to have some of these wonderful prizes that are in there, or incentives for scholarships and other things that have been put forward. So we have the information for anybody that gets vaccinated about that as well.
Do you have to manually enter yourself into that lottery, or as soon as you're vaccinated, do you just get put in the system?
So there is a little bit of a process. You have to go online yourself, and the website is there for you to do that. It actually is a form stack form that you just fill out with your name and information, and you upload your vaccination information, and you're entered.
Okay, easy.
That's pretty cool. Yeah, very convenient too.
And I will say it also is for any student that has already been vaccinated as well. You can also enter.
That's good to know.
Perfect. Yeah, good to know. Yeah. And I think somebody will toss the link in the chat there for the form stack for that incentive. Dawson, do you want to tell a little bit maybe about the vaccine drawing a little bit? Or
yeah, so I know we have some really awesome prizes, like Dr. Hagen English mentioned. There's the link in the chat, so please feel free to go click on that and enter in lottery right now. But I know we have some scholarships in there. ASUN's giving away some parking passes. We have, I know there's food bucks and food vouchers that we have. So there's really some great prices. I would go on that link and check it out just to see everything that we have. But it's a great opportunity. And you never know, you might be the lucky winner.
Yeah, I was gonna say I was able to enter into it in about 5 minutes. The longest thing it took was taking a picture of my vaccine card and tossing it on there. But I guess so. Since everything is very convenient to try to get the vaccine, especially with the pod locations, the location here at the jail and the student health center. Let's say I want to go get the vaccine over lunch, since it seems like it's a pretty quick process. What are some of the things that I can kind of expect after I get the vaccine? Like any sort of side effects, like if I've had COVID before or if I haven't had COVID before?
So another good question. And one of the things that we do for every person that's vaccinated is we ask that you stay at our clinic and wait for 15 minutes. And that's to make sure that you're not having a reaction. Very, very few people have had severe reactions to these vaccines, but we do want to take that extra step of being cautious. It is what we call an immunogenic vaccine, which is good, meaning it stimulates our immune response. And because of that, there are some side effects that people might experience, such as a little bit of a sore arm, maybe some muscle or joint pains, maybe a little bit of mild fever, and a little bit of a headache or those kinds of symptoms for a day or so after the vaccine. Many people don't have those, but we always let people know that, for the first 24 hours after, you might experience some mild side effects like that.
Okay, that's really good to know.
So I know one of the questions that Matt and I went out and we were kind of talking with our students about, I think it's on everyone's mind, but is it going to be mandatory to attend classes that you have to be vaccinated?
So I think that's a question we don't know the answer to yet. As you know, the State Board of Health actually is taking that question up today. I was listening to the meeting earlier this morning, and as of the time that we just joined, there had not been a decision or a vote taken. But they are the authority, they are the body in our state that has the authority to make that decision. If that decision were to be that vaccines are mandatory, it would go into effect for spring semester. So I don't want people to think that students who've registered for classes who are not vaccinated would be at risk for not being able to continue this semester. It would be, giving people time to get that done.
That's really good to know.
Yeah, I was going to say, I know a lot of students they're concerned about, do I continue to take classes if I haven't gotten the vaccine? What do I need to do there? But I know, after you get the vaccine, they typically kind of hand you a vaccine card. What would happen if you happen to lose that physical vaccine card? Is there kind of like an electronic version, or can you request a new one?
There absolutely is, and that's a good thing because those little cards are kind of tiny and they're easy to misplace or lose. And so anybody that's been vaccinated in the state of Nevada is automatically, and not just for the COVID vaccine, for any vaccine, your measles, mumps, rubella, tetanus, any vaccine that you've received in the state goes into a system called WebIZ. And when that is put in there, it is retrievable. You can go in as an individual and access your own immunization record. If you have trouble doing that, the Student Health Center can also go in and retrieve those records for you. So yes, if you lose the card, it's not the end of the world. We can actually print that record out for you.
Oh, cool, yeah, because I know when I got mine, it's kind of an awkward card. It's small, but it doesn't necessarily fit in your wallet. So it's good to know that there's, an electronic version. And I think they actually just pasted the link to the electronic vaccine card there in the chat if anybody wants to, check that out through WebIZ.
I'll just add to that, for students that were vaccinated in other states, most states have a system similar to that. California does. You can access your records through their site. Other states do as well. So those records are retrievable if people have lost their cards.
Good.
Gotcha. Okay, yeah, that's really good to know.
I've actually had to do that already, and it's a super easy process to go on that website. You can get all of it in a super timely manner. So, yeah, it's
That's really cool.
good to know.
Yeah.
But one of the next questions that we got from our students is, why are vaccinated people contracting COVID? How does that work?
Sorry, I missed that question. Can you repeat it?
Absolutely. So why are vaccinated people contracting COVID still?
So, as good as these vaccines are, no vaccine is perfect. And one of the things that we've seen happen, and again, I mentioned the recent Delta variant, the more this virus mutates and the more opportunity it has to mutate, the more difficult it is to contain it. And so it is still possible, and we are seeing what are termed breakthrough infections for people that have been fully vaccinated. The good news about that is that for people that get infected after they've been vaccinated, the infection typically is much milder and the recovery is much quicker. There are far fewer hospitalizations and certainly very few deaths in people that are fully vaccinated. So I think it's really important to emphasize that vaccination is still important, even if we may see some breakthrough infections. Those are different than what we're seeing in non-vaccinated people.
Got it. Okay.
That's good to know.
Yeah.
I guess for kind of building off of that a little bit, I know that some of the vaccines you have to kind of get a booster shot. Like there's a second one. I've even heard a little bit of a third one as well. Would you be able to explain kind of which shots need some of the boosters? And it sounds like that's pretty important in terms of combating this a little bit of this new Delta variant, and then kind of continuing on your immunity a little bit.
Yeah, so recently in the last week, the CDC first came out saying that they were recommending a third booster shot, if you will, for those that were immunocompromised. And then a few days later, they followed that up by saying that anybody that's been immunized more than 8 months ago, which, as you remember, the first immunization started rolling out in December, late December, early January. So starting September 20th is the date that the CDC has put out. They will start offering booster shots for anybody that's been vaccinated more than 8 months before then. Again, not required. I want to make that clear that the booster shots are not required, but for people who are concerned that their immunity might be waning, there's guidance that says that that's recommended. And again, we because we've not been doing this for a long time, we don't know how long the immunity lasts. And so we are beginning to see some of that wane after 6 to 8 months, which is why they're now recommending that a booster shot may be important.
Actually, that's good to know. Yeah, I was going to say 8 months puts us back kind of right at the end of January there. So might be kind of coming up for some of us. We'll see.
Awesome. Okay, so switching gears a little bit, more away from the vaccine and more towards the testing side. Is the Student Health Center still offering COVID testing?
We are, and we have been busily testing. We've been doing over 100 tests a day. We have 2 nurses out there all day long that are just doing COVID testing. And it is, again, you need to call and be put into a slot so that we're not having big lines of people standing together. Very easy to do. You can also schedule online by going through the patient portal, which you can find on our Student Health Center website. But it's simply you answer a few screening questions, you come up, the actual testing takes less than a minute. We do have several different types of testing available. And I think that's important to know. So we are doing the rapid antigen test, which is the Binax test. Results of that come back in about 15 minutes. The great thing is that there is a Navica app that you can download on your phone, and we can actually just put that result right into your phone for you. And then you have record of it if you need to show it to someone else. If you're living in the res halls, if you need it for employment, you have that record right there. We also do PCR testing, which is, again, that same nasal swab, but it goes to the state lab. That result takes a day or two to get those results back. That is really considered the gold standard of COVID testing. It's a little bit more sensitive than the antigen tests like the Binax. And then finally, we have what's called a Cepheid PCR test, which is at our clinic and takes about an hour to get results. That costs $40. That is our cost. We don't up it to anybody, but for people that need a PCR test for travel or something immediate, it's a good option because we can get you that PCR results that same day. So those are kind of the three forms of testing that we have going.
That's really awesome that we have that on campus. For the first two tests that you mentioned, are those both free?
Yes, the Binax and the PCR tests are free.
That's really cool.
Okay. Yeah, I was gonna say. Well, and then so I guess if I'm on campus and I hear through either the COVID Trace app or at least maybe like if one of my professors ends up sending out a email saying, hey, a student in our class ended up contracting COVID, should I still go get tested even if I've had the vaccine, or should I just kind of say, okay, well, I've gotten the vaccine, I should be fine?
That's a really important question, and I think one that is really something that we need to talk about. It is important if you have been exposed to someone in a close contact situation, and again, just to define that is if you've been less than 6 feet for more than 15 minutes, regardless of whether you have your mask on or not, that's considered a close contact. If you've been in that situation and you are fully vaccinated, you should still test 3 days after that exposure. Don't come up 30 minutes after that exposure or even that same day because it's too soon. But wait a couple of days, come up and get tested. You do not have to quarantine, however, while you're waiting for that test result if you're fully vaccinated. You should still be cautious and wear your mask. And certainly if you've been exposed, even consider wearing your mask in any kind of public situation, whether indoors or out, until you get that result back. But if that result is negative, you do not have to quarantine. If, however, that result is positive and you're fully vaccinated, you still do need to then isolate for that 10 days, just like anybody else would. Because as we've talked about before, vaccinated people can still get infected. And so we need to isolate those as well. For those that are not vaccinated that have had an exposure or close contact, for those individuals, they can still come and test, but regardless of that test result, they need to quarantine for 10 days. And the reason for that is, again, they don't have that extra layer of protection that vaccination provides. So they need to quarantine regardless of whether they test negative. Does that make sense, or have I confused it?
No, I think it makes sense. Plus, I know Vice Provost Gentani yesterday was talking that, if you are exposed and you're living in the residence halls, they have specific areas for you to quarantine, which I think is really cool. That way, you don't have to feel like you'll get your roommate sick or anything like that. You can go into a specified area. It's kind of a cool thing. Yeah.
One of the questions that we came up yesterday for Vice Provost Gentani that we wanted to ask you too is, how are these mask mandates and the isolation kind of efforts going to be enforced?
So I think that obviously, it's a social responsibility that we all share, right, as part of our campus community. And the idea is to make people aware in classroom situations and any indoor spaces on our campus that is the mandate that's come from the governor, from our county and our campus. So we want to support that, and we want to make sure people understand the reasons behind that. We're in a surge again right now. Our positivity rate in Washoe County is about 19%. That's very high. And so we need to take those precautions that we know make a difference. And masking, particularly while indoors, is one of those. As far as enforcement, obviously it is going to be faculty and conversations with students and reminding them, because some of them who are new may not know about the policy or have forgotten. Masks will be available in classrooms if people forget their masks. And then, obviously progressively, if students are not wanting to follow those policies, they may be asked to leave the classroom and not continue to stay in that environment. The idea is we want to support our campus community and keep all of us as healthy as we can.
Sounds like a good plan. Well, yeah, we did want to say, Dr. Hug English, thank you again for joining us. Did you have anything that you wanted to kind of share on your end? Maybe some of the services for the Student Health Center or, anything like that coming up?
Well, just to welcome all of you to campus, to let you know the Student Health Center is here for you. Not only are we providing COVID-19 services, we are here for your physical as well as mental health needs. We have psychiatry services here on campus at the Student Health Center, and really full service clinic for all of your healthcare needs. So we are located at the north end of campus. For those of you who don't know, kind of past the football stadium, across the parking lot from the School of Medicine. So again, we're here for you. I think the last thing I would say is, we are a campus community, and I think that, our motto is the strength of the pack is the wolf, and the strength of the wolf is the pack. And I think that really sums it up, that we need to support one another in trying to do the right things in helping keep our campus safe and healthy for this semester.
We really agree, and we're trying to do everything that we can to protect the pack and really make sure all of our students feel that way, that we're all this community. We're one wolf pack.
Yep. Ready to kind of move forward here. Well, yeah, thank you again for joining us here. So I hope you have a good rest of the day, and it was great hearing from you about all of the things kind of going on about COVID, I think.
I wish a happy semester to all of you. Bye-bye.
Thank
Thank
you.
you.